Assalamu alaikum. Let's start our second part of antifungals with azoles that are ketoconazole, itraconazole, voriconazole, fluconazole, posaconazole, etc. In the previous part, we have seen the mechanism of action of different antifungal drugs through our diagram. In this diagram, we have talked about the mechanism of action of azoles, that how they are reducing the synthesis of ergosterol. Basically, azoles are blocking an enzyme 14 alpha demethylase which converts lanosterol into ergosterol. By inhibiting 14 alpha demethylase, azoles are reducing the synthesis of ergosterol. Resistance occurs by decrease intracellular accumulation of drug. Let's see the clinical uses. First one, we have ketoconazole. The use of ketoconazole has been reduced drastically nowadays. It has narrow antifungal spectrum, and because of more adverse effect than other azoles, ketoconazoles are rarely used for systemic mycosis. They are core drug of choice for paracoccidioids and backup for blastomyces and histoplasma. Parenteral form of ketoconazole is not available. Oral use of ketoconazole in mucocutaneous candidiasis or dermatophytosis has been reduced drastically. Next one is fluconazole, which is a drug of choice for esophageal invasive candidiasis and coccidiomycosis. A single oral dose of fluconazole usually eradicates vaginal candidiasis. Fluconazole are used for prophylaxis and suppression in cryptococcal meningitis. About meningitis, we have studied earlier that a combination of amphotericin B and flucytosine is used to treat meningitis in initial stages, and then after a certain period of time it is switched with other drug, like we have fluconazole. Next is itraconazole and voriconazole. They are the drug of choice in blastomycosis, sporotrichosis, and aspergillosis. For aspergillosis, specifically, voriconazole is used. They are the backup for several other mycoses and candidiasis. Itraconazole are used extensively in the treatment of dermatophytes, especially onychomycosis. Voriconazole. Voriconazole has wider spectrum than itraconazole. Voriconazole is used in AIDS patients to treat stomatitis and candidal esophagitis. Next is posaconazole, which is a broadest spectrum triazole. Posaconazole is active against Candida aspergillus. And important thing, posaconazole is an only azole with activity against rhizopus. Rhizopus is one of the agents of mucormycosis. Posaconazole are used for prophylaxis of fungal infections during cancer chemotherapy. Next we have mecanazole and clotrimazole, which is used topically for candidal and dermatophytic infections. About the pharmacokinetics, they are effective orally. As far as the absorption is concerned, absorption of ketoconazole is reduced by antacids. Antacids decrease the absorption of ketoconazoles, while the absorption of itraconazole food enhance the absorption of itraconazole capsule. In capsular form, the absorption of itraconazole is enhanced by food, while oral solution form of itraconazole, its absorption is reduced by food. Let me repeat this point. Food can enhance the absorption of itraconazole capsule, while it decreases the absorption of itraconazole solution, oral solution form, liquid form. Then another important point, fluconazole is the only drug that penetrates into CSF. That's why it is used in treatment of meningeal infection. And about the metabolism, ketoconazole, itraconazole, voriconazole, they all are metabolized through liver. So, dose reduction of these drugs are required in case of liver dysfunction, while fluconazole is metabolized through kidney and is eliminated in the form of urine. So, in case of kidney dysfunction, dose reduction is required. Ketoconazole is cytochrome P450 inhibitor, and so they can increase the plasma level of many other drugs including cyclosporin, oral hypoglycemic, phenytoin, and warfarin. Let's see the side effects of azoles. As I just told you that ketoconazole is an inhibitor of cytochrome P450. So, inhibition of cytochrome P450 isozymes, they can interfere with the synthesis. They can decrease the synthesis of adrenal and gonadal steroids and results in gynecomastia, infertility, and menstrual irregularities. Voriconazole is also associated with immediate but transient visual disturbances, including blurring of vision in almost 30% patients. Next, we have echinocandins, which ends with fungins like caspofungins, anidulafungin, and micafungins. The mechanism of action, which we have already discussed, that echinocandins inhibit the synthesis of beta 1,3 glucans, which is a critical component of fungal cell wall. The clinical uses of echinocandins include caspofungin is used for the disseminated and mucocutaneous candida infections in patients who fail to respond amphotericin B and in the treatment of mucormycosis. While any dulafungin is used for esophageal and invasive candidiasis, and mycofungin is used for mucocutaneous candidiasis and for prophylaxis of candida infections. In bone marrow transplant patient, to treat the candida infection in bone marrow transplant patient, we use mycofungin. About the toxic pharmacokinetics, caspofungin is administered intravenously and is eliminated through elimination is by hepatic metabolism. Caspofungin has a half-life of 9 to 12 hours. Micafungin is slightly longer, and the half-life of endulafungin is about 2 to is 1 to 2 days. which means 24 to 48 hours. Toxicity is infusion related effects of caspofungins, which includes headache, GIT distress, fever, rash, and flushing, which is because of histamine release. Micafungin also causes histamine release and it elevates the blood levels of immunosuppressant drugs like cyclosporin and sirolimus. Combined use of echinocandins with cyclosporin, they may elevate liver transaminases. Now we are left with flucytosine and ricofulvin. We will discuss them in next video. Thank you. Allah Hafiz.